I'm Dr. Hank Simpson, Chief Executive Officer of Red Cedar Medical Center. We're delighted that you've chosen us to provide care for your growing family. I trust that you'll find the following information about pain management options useful as you plan your birth experience. Thank you for choosing Red Cedar Medical Center, part of Mayo Health System.
Red Cedar Medical Center, Mayo Health System presents Pain Management Options, an informational video on pain relief in labor and delivery.
You know, I really think that when you're getting closer and closer to your due date, you really do start thinking about your pain relief options for labor and delivery, because you're really unsure of what's going to happen, especially if it's your first time. And I think typically women fall into three categories. There are those women who are quite certain that they do want pain relief for their labor and childbirth. There are those women who are uncertain if they want pain relief or not. And there are those women who are quite certain that they do not want any pain relief measures for their labor and their childbirth.
Red Cedar Medical Center offers non-medication and medication pain management options. Your labor partner or coach, nurse, and provider will help you decide on and initiate pain management. Non-medication pain management may include breathing and visualization, music and lighting, use of a rocking chair, position changes in walking, water therapy, use of a labor ball, massage, and warm packs and cool cloths. Here at Red Cedar Medical Center, there are two different techniques available for anesthesia in labor and delivery: the intrathecal narcotic, or ITN, and the continuous labor epidural, or CLE. The ITN technique is generally used for women who have achieved a greater degree of cervical dilation and are expected to deliver soon. The ITN is a one-time injection given in the lower back, known as the subarachnoid area. The medication used is a combination of local anesthetic and a narcotic. The ITN technique results in a rapid loss of feeling below the waist and the inability to move your legs. This sensation usually lasts only 2 to 4 hours. The pros to using the ITN technique include profound and rapid analgesia. It's easy to perform, and minimal setup is required. The cons to using the ITN technique include a limited duration of pain relief. The second labor analgesia option at the Red Cedar Medical Center is called CLE, or continuous labor epidural. This technique may be used regardless of the degree of cervical dilation. However, the mother must have an active labor pattern established before this option may be used. A CLE involves the placement of a larger needle than used in the ITN technique. This needle is also inserted into the lower back, this time into the epidural space. The larger needle allows a small catheter to be passed into the epidural space. The needle is then removed and the catheter is taped in place. The catheter allows an infusion of medicine. As with the previous pain relief method, CLE also combines an anesthetic and a narcotic. An advantage to CLE is that it allows most women to fully participate in the birthing experience. CLE allows you the ability to still touch and feel while relieving most, if not all, the pains of labor. The pros of CLE are continuous administration of medicine, very good pain relief results are usually achieved, and it may be used to provide anesthesia during C-section or postpartum tubal ligation. The cons of CLE include the possibility of becoming time-consuming and difficult to perform, the amount of equipment involved, and the need to be replaced if the catheter becomes dislodged or anesthetic is ineffective. Both the ITN and CLE techniques involve the expectant mother to sit bedside. This allows an optimal position for the administration of the anesthetic. There are possible side effects and complications involved in both procedures. Common side effects include itching, especially of the face, nausea, a decrease in blood pressure, mild discomfort during needle insertion, and soreness in the lower back. Rare side effects include inability to place needle due to obesity, scoliosis, or unusual anatomy of the back, inadequate pain relief, one-sided pain relief, spinal headache, numbness or tingling in the legs. There's also a very remote chance of seizures, a severe drop in blood pressure, respiratory arrest, and permanent nerve injury. These complications are avoided by carefully testing needle and catheter location and by the slow administration of medicine. There is only a remote possibility you'll experience one of these serious complications. Again, the two pain management options at Red Cedar Medical Center are the intrathecal narcotic, or ITN, and the continuous labor epidural, or CLE. The intrathecal narcotic is a one-time injection given in the lower back. It is a combination of local anesthetic and a narcotic. The rapid loss of feeling below the waist usually lasts 2 to 4 hours. The continuous labor epidural involves the placement of a catheter into the lower back. The catheter allows continuous infusion of medicine. This method also combines an anesthetic and a narcotic.
Typically with the intrathecal narcotic or the continuous labor epidural technique, mothers experience profound pain relief with minimal effects to the baby. Complications are rare and the mothers are very satisfied.
We hope many of your questions about pain relief during the childbirth process have been answered by this video. Thank you for choosing Red Cedar Medical Center Mayo Health System.